Let me call the first speaker, Ms. Winnie Mwasiaji, whom I had the benefit of meeting in Kenya and was the national coordinator of the program. She will give us an insight into the Orphans and Vulnerable Children's Cash Transfer Program in particularly, but make reference to other areas of work as well. So, Ms. Winnie, if you could come and join us.
Good morning, everybody. I'm very scared of the chair because the chair says when he shows me red, I really have to go out, I don't appeal. But my worry is that when I look at the topic I was told to talk about, I was told to talk about almost everything. My experiences, evidence, impact, financing, scale up. I think that I'd need about a day, so I don't know. I don't know at what point he'll show me the red, whether it will be after one day or what. But please start now. I hope you have not started counting. Secondly, I want to say that I'm not going to talk on a specific program because I don't head a specific program, but I'm doing the coordination of social protection in the country. So I'm going to talk on bits and pieces of the programs, what we have as a country, look at the background, how is social protection started in Kenya, some of the gaps in general social protection, that is including how we look at it in Kenya, looking at social assistance, social security, and health insurance. I'll touch a bit on impact. I have my colleague here who will focus mainly on the Orphans and Vulnerable Children's Program, so I will just touch a bit on it. And then some of the reforms in the SP arenas we are doing, and a few probably lessons learned or recommendations that we have as a country. That is the country profile, and that is why we need social protection in the country. If you look at the population and look at the number of orphans that we have, basically this just tells you that as a country, we really do need social protection as an intervention to help those who are poor and vulnerable. Because you're looking at the various things that actually constitute to the issue of social protection. Kenya, like many other African countries, actually have had social protection. It's not a new thing. It's something that we've been doing. It is something that is very rich in the culture. And if we're able to, yesterday the ministers talked about some of the good traditional things that we need to take in place. We had a lot of care of orphans. We didn't even have orphans like somebody said. We didn't have them. Because if your child died today, definitely there's somebody who will walk into your shoe. And that child will be taken care of like yours. We had weddings. You cannot say that I don't have money for a wedding. People would contribute. People would come. That is social protection. Everybody would come and you get a wife and actually carry home. So we had a lot of mechanisms to be able to protect people, and we lived well. Funerals. This time, I'm telling you, in Kenya, you die today, you're wondering how you'll ever bury that particular person. The systems are broken down. But long time, you'd be buried very nicely. In my culture, there were a lot of slaughtering of cows. You didn't even have to worry, where will I get the cow? People will just bring the cows and they'll be slaughtered. That was bringing in a community of social protection. But with that, with the breakdown of traditional ties, a lot of things have happened. So we have to come to more formal kind of social protection. So there are a lot of policies and programs we have put in place, even Kenya as a country, to be able to take care of our vulnerable. But unfortunately, they are not working so well. Why? Some of the interventions are very inadequate in themselves in how they're doing, and they're not even enhancing the job creation in terms of what we are supposed to do. And then they're also not supporting poverty reduction. Are they really? We have systems in place, we have good policies, but are we implementing them to be able to support poverty reductions in the country? I'll take you through quickly through some of the interventions we have in the country. We have put in place several. The most popular one is the cash transfers. Our cash transfers are doing very well. We have about 5 cash transfer programs. We have for the orphans and vulnerable children. We have for the older persons. We have for the persons with severe disabilities. We have for the urban setting. This one mainly came about because there was a lot of economic difficulties at a particular time when the fuel and all the cost of that had gone up. Most of our cash transfers are actually giving very little amount, moderate amount. Most of them are giving $23 a month. But they're working. $23 look very little, but they're actually working. Why the cash transfer? I know many people say that why do we do cash transfer? But we found it's the best starting point. It's where you can start because you're able to give somebody something immediately and they're able to use that to be able to relieve their immediate needs. And administrative cost for that is actually very little. You don't need so much. Like Kenya now, we have things like M-Pesa. You can actually transfer that money and able to get it to the person without so much difficulty like transferring food and other things. And also it gives the poor a choice. Some of these things we have don't give a choice. But if you're able to give the money, somebody's able to choose, where do I want to spend? Where is the need pressing more? Where would I want to spend this money? So that is some of the justifications as a country we agreed on as cash transfer. Our government has really done a lot in terms of cash transfer and scale up. The blue color is where we are, and the red one is where we are scaling to this particular financial year. So a lot of money is being given towards cash transfer. I cannot say why. I don't know whether we have managed to convince the politicians or it's more of the political trying to get your voters. But we don't care. We are saying so long as the people are protected. We are not bothered. That is the scale up in terms of financing for the country. It's actually really shooting up. If you look at the blue line for the cash transfer for orphans and vulnerable children, it has really shot up this financial year. They have actually doubled the money. And it's something that we didn't even ask. We asked for a little increment. But when it came, we saw it was double, and we said, oh, hallelujah. And we said, that is good for a country. We have other social protection interventions. In health-related, we have a lot of waivers now. Our president, when they came in, the new president came in, he said that anybody who is going to deliver, any mother who is going to deliver in a maternity government hospital will be free. That is social protection we are saying that we are having. For the hospital waivers for the children, for the waiver for the children under 5s and pregnant mothers to be able to go for antenatal cleaning, that is also free. We have other social protection measures like the National Hospital Insurance Fund. It's contributory, but we are trying to pilot something where we are trying to cover the vulnerable groups. Especially right now, we have just piloted on 15,000 households of vulnerable children, where we are trying to give them, as much as you give them cash transfer, you're also giving them health cover. So, because most of the time you give them this money for cash, they end up using it for hospital. So everything goes to the hospital, they forget about food. And when you're going to hospital and you're not eating again, your health is not good. So when we decided to see how, if we pilot cash transfers and also give them health, will it make a difference in this family? So that's something we are doing for a year, and then we'll be able to see whether it's working well. We have other interventions like social security. Social security, all these are contributory. So for a poor person to be able to get this, it's very difficult. Most of them are people who are working in the formal employment. Apart from the retirement benefit of authority who are trying to do something on the informal sector, they are still covering very little, because even being able to organize the informal sector to be able to make them contribute is quite difficult. But that is an area that I think as a country we really need to push forward to be able to see how do we improve the lives of these other people. We also have some active labor market programs that we are running. Quite a number of them, including the public works that is very popular in Ethiopia, well known. Then we have some economic empowerment program like secondary and bursary school waivers. We have the Women Enterprise Fund. We have free primary education. We have subsidized secondary education. I know they are difficult to get, but somehow they are happening. Maybe also they are targeting wrong people. Again, targeting is a challenge, but these programs are in place. So probably what we need to do is how do we ensure that the targeting is properly done to be able to get the most vulnerable members of the community. Some of the in-kind transfers that we have in the country include the ones focusing on disability, where we give wheelchairs, we give brails and hearing aids. Those are some of the protection measures that we try to do to give to the most vulnerable people that we have. Agriculture input. That is one of the very good things for complementary activities. And we are saying if you are able to use the agriculture subsidies to be able to subsidize, to help, to give to those who are receiving cash transfer, that again will help them also be able, I know we said they cannot graduate, but we are saying how do we enhance their capacity to improve their resilience to poverty and to vulnerability that they are having. As I said, there are lots of gaps. Most of the policies and programs are very scattered, and that has really minimized the impact that we could have created. Every program implements on isolation. So that, again, if you're not complementing each other, you're not creating any proper social protection system. How do we make sure that our programs, our policies, our strategies are speaking to each other to be able to achieve effective social protection systems? The issue of inadequacy, irregularity, low coverage is a great challenge that we are still struggling with. And I'm saying some of the interventions that we think are social protection also leave out the very poor. If you look at the credit facilities, which poor person will be able to go for? We have put them in place. We are saying we have credit facility for the poor women. But are they really able to go for these credit facilities? Because they are worried. If I go and take the credit and my child is sick, am I going to use that money to do business or to feed my child? There's which option do I take? I've taken money on credit. I've taken some credit to do some business. I have a sick baby here. What am I supposed to do? Is the baby supposed to eat? Is the baby supposed to go medical, or do I do business? So that is something that really, the option makes it leave, that's kind of social protection leave out the very poor. The issue of targeting, of course, I don't want to overemphasize that, but I've mentioned that it's really a big challenge in our countries. And then again, the issue of contributory for most of the sectors is another very big challenge. We have some very wonderful impact. I know my colleague will come out with that. Oh, 5 minutes, okay. So we have some wonderful impacts that have happened in terms of areas of education. We have some other impact on the areas of improvement in the livelihoods of these people. The issue of stability. Some people have mentioned stability in their households. So a lot of good things are happening with social protection in the countries. And mainly some of them is because of the cash transfer that is being given. Changing on coping strategies. Some households, you go to them, they tell you, how are they coping? They'll tell you, I'll go and sell my body to be able to live on. But now they are saying, with the cash transfers we are getting, with the social protection we are getting, I have other options that I can do. So people are given an option to be able to live more decently in whatever they are doing. I'll just mention quickly some of the key things, excuses that we give for not having social protection. Issues of affordability, is not affordable. Issues of accountability, are the poor people really going to account or use this money properly? Issues of coverage, do we do universal versus targeting? Issues of sustainability, how do we manage these issues in Africa? These are questions that our politicians keep asking us before you get any funds. So we need to think about them as we continue doing our social protection programs. In Kenya, we have done a lot. We have done the Constitution. The Constitution of Kenya actually clearly spells out that the government must be able to take care of its poor and vulnerable. And therefore, with that, we have also formulated a national policy on social protection that is helping us institutionalize the social protection in the country. We have the sessional paper, and we also have the bill that we are waiting to take in place. That is how we look at social protection in Kenya. It covers the 3 broad components. That's the institutional arrangement that we intend to use to cover that. Some of the systems we are trying to put in place is to for the programs to be able to talk to each other. We want to come up with a proper registry that will allow interaction between the programs. And that also allows for complementarity, because you're not able to implement a program on its own and be able to succeed. There's no way you're going to reduce poverty. There's no way you're going to give full coverage if you're not able to let the programs be able to speak to each other. We are improving on our mechanisms, especially payment mechanisms. We have been moving from actual giving of cash where you sign or you put your thumbprint to a more advanced way of transferring money. Finally, I'll beg for 1 minute or 2 more on top of my minutes so that I can just give out the lessons we have learned as a country. For us to be able to actually properly implement, we need to have effective administrative structures that is going to administer all the processes that you have. If you don't have good administrative structures, you're not going to move forward in terms of social protection. Decentralization, don't want to do everything. How do you let other people also come in and do? Share responsibilities, whether it's across the ministries, whether it's across the various sections, so that everybody, if I'm handling payment, let me handle payment. Don't try to do payment when you can't do payment. When you're handling targeting, can you do your targeting and do it perfectly? So that everything you're doing is done perfectly. Try to distribute what you're trying to do. Application of good delivery mechanisms. How do you ensure that you're delivering social protection to the right people? How? Because most of the time we are delivering social protection, but we're not giving the right people. Even us as a country, we have evaluated. Some of them are not going to the right people. How do you make sure that the delivery mechanisms are able to reach the poorest in a most effective and efficient manner? Financing. This is a place where we shy off, and we try to look for partners to support us. But one thing we have learned, that if you don't, as a country, come out and support, fund your social protection components, you will not be able to move. We have donors, they are our friends. The money is good from them. But sometimes when they're annoyed with you, you will know it. Because if you are giving cash transfers, and you expect them to give you money and that day you have done something that they don't like, no business as usual. You can imagine what will happen to your people. So ensure that you have the national funding. Once you make sure that, let them fund other technical things, but ensure that the main components of the programs are funded from the government finances. Issues of good governance. We have a big challenge in Africa. We have a lot of big challenges. We really need to work hard on governance issues for us to be able to deliver effective social protection. Integrated approach. It was mentioned here. Without having integrated approach, you're never able to move. Let's integrate our social protection to make it into a system where we don't implementing ad hoc social protection programs. You're about to show me red. Have good M&E systems. If you don't monitor your programs, you're not able to move. Monitor your programs, know where you are, where are the gaps, where are the mistakes you are making for you to be able to learn lessons to help you move forward in terms of implementing. Good targeting mechanism, of course, we cannot overemphasize that. Issues of policies and legislations. If you don't have policies and legislation, you're just implementing, then you're going nowhere. Have policies, foundations where you lay your social protections on them. Issues of political will, good leadership and accountability. If you don't have political will, thank you, 2 minutes, I'll be done before the 2 minutes. Issues of political will. If you get good political will, you will get money. You will definitely get money. So make sure that you get the political buy-in for your programs. You will definitely be moving. As a country, I can tell you, we are really moving. And as I said, I don't know how the will came, but it is there. Again, for effective implementation, there must be access to essential services. If you're not giving essential services, you must make sure that the education system is working well. Make sure that the healthcare services are also provided. Issues of birth registration for the children. All these things are some things that are supposed to be affordable and reachable, accessible to all the citizens. If you're able to do that, make sure that all these are in place, then you'll have a good social protection system. Thank you very much. You're showing me red. Thank you.
I think you will agree with me, and this has been my experience with Winnie, is that although she has listed a number of important and critical issues, be they political, administrative, institutional, it's often the determination of officials that also play a role in getting all of these things together, and that's how I've experienced Ms. Winnie in Kenya in the programs that she drives there.